So as the viewers can see, she's definitely limping. You're in a lot of pain.
I'm in a lot of excruciating pain.
Okay, so let's just break it all down. So which one's killing you right now? The hip pain, low back, what's the story?
It's my right hip, and I have shooting pains all the way down the right side of my leg.
Where does the pain stop?
Right here. Ow.
Right over there. Okay.
But obviously it's hard for me to move, it's hard for me to walk. And then I do have lower back pain, but it's excruciating here. Oftentimes I actually have numbness in the top of my right arms as well.
Numbness over there. Okay. All right. Any neck pains or nothing?
I mean, a little bit like on this side, yes, but it's all really on my right side. Sometimes I'll have pain on the left, but today it's just excruciating on my right.
It seems like right now, what's most comfortable for you? You have no problem standing, walking, or sitting?
Do you know, at this point, it all is painful, but it's the most excruciating when I'm either sitting. Actually, it becomes unbearable right now when I'm sitting.
Sitting's the worst?
Yes. And so
walking, does it make it better or does it make it worse?
It makes it worse right now because it's gotten so bad.
Okay.
Standing it's still a dull pain, but I don't have it as extreme going down my leg.
Okay. So part of the history and part of how the diagnostic works is this: how we could differentiate between an actual lumbar spine problem and an actual hip problem is what you actually just described there. Okay. Usually when you walk, okay, and it gets better, that's a lumbar problem. Lumbar problem. But the fact that you're walking and it makes it worse, okay, that's a hip problem. The reason why is because the discs themselves, okay, they get their food and nutrients from walking. So every time you move around, it actually makes it better.
Right.
We don't have that case. So if the hip problem, if there really is a hip problem, every time you walk, it's like grinding on bone on bone. It's just not fun, okay? So therefore, that's how we're going to confirm on you that it's an actual hip problem. Now, taking a closer look at these x-rays itself, okay, there are a couple of things I'm seeing over here, okay? We're going to be very brief because I understand you're, not fun right now, okay? So the whole hip is sinking down this way. So the one that makes it sinking down that way is going to be either a PI, EX, or PIX type of misalignment, or a short leg on that side. But also what I'm seeing over here is that this sacrum over here, it's kind of almost in the neutral position, but you also have this open wedge over here. This is supposed to be one solid bone. Okay. Now the reason why we want all the pieces, because as you know, you had kids. Okay. Popping out one solid human being, not fun.
No.
Okay. So that's why you want all these in pieces. So therefore, they're going to fuse later on. This is the last bone that fuses into one piece as an adult. This is around 27 to 32 years old, that late. However, because you had some kind of trauma to the sacrum, that's why it never fused properly. So there's an open wedge right over here, and we're going to confirm that on you. But now the other things I'm also seeing is that you have a slight little arthritis on here, just very slight, but also more telling is you have a lot of arthritis over here. Okay. Now, due to the way our spine is, and we're constantly moving, the reason why you have started to develop a little arthritis here is because if this hip over here externally rotates this way, okay, what's going to happen? Can we walk this way? No. It ain't going to happen. So the whole entire torso has to rotate and twist. So when it rotates and twists so much like this way over here, you're going to develop this arthritic formation on the opposite side of the externally rotated hip. Okay? So now, because of this torque you got going on over here, where everything is steadily twisting like that way over here, that's when we start to have this biomechanical tension right over here. And since it's been there for so long, okay, eventually that compensation becomes into a problem, and then it becomes fixated and stuck. The problem is over here is that we still need to rotate and move our head. So over here, it still continues to rotate even more this way. So this new little midpoint over there is that. That's what became arthritic and tight because, like I said, you still need to move and rotate your head. So over time, that fellow over there, there's only so much it could bear the front, and it just grinded away so much. So, and on top of that, this fifth cervical nerve root goes down your shoulders into your biceps. That's why we tested you earlier. You have some numbness and tingling over there. And I wouldn't be surprised. You start to feel some issues in your elbows and sometimes in your thumbs. Okay? That's the same nerve that goes all the way down there. In addition to, this fellow also goes the nerve to your thyroid, so you may experience some sluggish, lethargic, fatigue, right? Yeah, no big surprise. So, therefore, now here's the thing though, okay? Since the way you're walking the way it is, and I'm gonna include to the viewers, okay? That's a classic EX gait, all right? The way you're limping, the way it is. So, I'm gonna confirm on you, which one we really need to address. Do we need to address this one or this one? But the way you describe it, also you're sitting down in sharp pain, sounds like that second sacral segment over there. Okay, so if we do adjust this one over here, what's going to happen is it's going to nudge it forward like this. And if it does so, here's the thing: the type of misalignment of the ilium that calls to adjust with this is going to be a PI, EX, or PIX, meaning this old hip injury is going to rear its ugly head up pretty soon. So even though you may feel relief over here, okay, and I wouldn't be surprised, some of your walking gait may be improved, okay? I don't want you to go freaking out and say, oh my goodness, I have a new type of low back pain. Now this fellow over here, I used to have a right hip pain, now I have a left hip pain. What the heck is going on, okay? Like it says, this old fella is gonna start showing up. I wouldn't be surprised in the next couple of weeks. So in the future visit, we do have to take care of this fellow over here. And by addressing this fellow over here, it's going to unravel the entire spine that's currently going like from like this kind of twist. It's going to unravel all the straight up, especially this huge curve going over here. Calm down this arthritis here and arthritis over there as well. Yeah, and then we're also going to take a look at your feet later on. Okay?
Yeah, okay, amazing.
We're going to do a visualization as well as inspection. Okay? We do see a lot of spasms and swelling on your neck over here. It should be smooth, but it's not. Same story over here, this upper back over here. Okay. Some swelling right over here, we'll mark that level. So you also have a lot of swelling, it's all puffy right here. Everything's puffy.
Everything is puffy, everything.
Yeah. Now we're going to use this instrument device, so because the tissues are damaged and swollen, okay, it's going to start off that inflammatory response as a defense mechanism. And this device over here is like a very fancy thermometer. Okay, it's comparing one side to the next. And what I'm looking for is a particular heat pattern. Okay. And this helps identify and isolate which particular levels might be potential areas we need to take a closer look at. It's not exactly saying that these are the ones we definitely have to adjust. Not necessarily. Again, we want to accumulate as much objective data as possible. So we want to be very certain that these are the proper ones we really need to address on you. As a Gonstead method, what we do is we find that old saying, you know, if it ain't broke, don't fix it.
Yeah. I have a lot that seems to be broken though.
Yeah. Alright. Tender right here? Yeah. What about here?
Not as much actually.
Not as much. So even though you have right hip pain,
yeah.
See the left?
Yeah, it's much more
painful. Tender right there?
Oh yeah.
Okay, we found it. That's a 2S. What over here?
It's tender. It doesn't hurt as much.
Yeah. So, but this EX, this thing is stuck. It's not moving at all.
No.
This is also stuck too, but partly jams comes from this. So. Yep.
Oh yeah.
2S is really jammed. Not too bad here?
No, it's sensitive, but it's not like, it's not painful.
That fourth lumbar is also not too great either. And how about this fellow?
Oh yeah.
Yeah, that's your 6th dorsal. Oh, that fellow right
Very
there.
sensitive.
Yeah, that's 2nd dorsal.
Very sensitive. Oof.
Okay, sorry, I'll try to be efficient here as much as
absolutely.
possible. Right there. Yeah, that 5th cervical is not fun at all. Okay.
Oh. Sit right here.
Yeah, put your head right there.
Okay.
Come to the edge.
Oh.
Okay, take a breath. Now, because this thing is so acute, so swollen, okay, our usual table of choice, we will not be able to use it because you will not like it at all. It'll be too uncomfortable for you. So we're going to use this instead. Just relax over here. Just relax. Okay. Come on up when you're ready.
Okay.
When you're ready, go ahead. Walk around.
Okay. Oh, wow. I can still feel a pull, but wow, okay.
Go ahead, walk up and down the room.
Feels a lot better. A lot, yeah.
How much improvement would you say?
I would say it's probably 65% improved.
Good,
Yeah,
good.
yeah.
Try sitting down. You said that that made it worse.
I still have a little here, but it's better. It's definitely better.
Good.
Yeah,
Good.
yeah.
Excellent. Because right now, on today's visit, right, I want your body has a finite, limited amount of resources to repair itself. Okay. So as I mentioned before, your low back over there, the hip, it's very swollen.
Yeah.
So you're gonna put a cold pack over
Okay.
that area, 20 minutes every 2 hours. You need to pump all that stuff out of the way.
Okay.
And right now, as much as I love to adjust and address everything else, the rest of your spine, okay, we're not gonna do that. Again, everything needs to focus to heal that low back of yours, okay? Don't be surprised because since that's the foundational piece, your symptoms is gonna be like a roller coaster, okay?
Okay.
So you're gonna be all over the place. Some areas gonna feel really great, some areas not so great because again, your whole entire spine is all twisted up and it's
Right.
trying to unwind itself and then rewind itself again into
Right,
that
right,
pathological
right, right,
position,
right.
okay? So be patient with the process. We're gonna see you the next visit and I wanna see how you respond from that.
Yeah, how
All right?
quickly can I come back?
Tomorrow, actually.
Really?
Yep.
Okay,
So
fantastic.
we'll see you tomorrow.
Okay, great. Thank you so
You're
much.
welcome.
I appreciate it.
Give us the latest updates. How is your low back doing?
You know, it was sore the day of and the day after. It's feeling a lot better now. I still have slight pain in the hip, but I can walk and I'm not limping.
Hey, that's great.
Interestingly, the night after the adjustment, though, I was in agony in different parts of my body, and I remember you telling me that it was going to kind of unlink things.
Yeah.
So, yes, definitely feeling better. I got the seat that you recommended, and I could actually sit at my desk without pain, which is great. So, you know, I can still feel a little inflammation here, and I have the belt that I'm going to start wearing. So, yeah.
Okay. Yeah, let's show the viewers. Let's have you walk up and down
Yeah.
this hallway for me, please.
Yes. See, no limping.
Yeah. You know, regular speed. Okay. Now we're in business. This thing's ready to be set.
Okay, good.
Kind of decent. Double check. How's it feel here? Not too bad, right?
Not too bad, no.
Good. Okay, step back for me, please. How's this fella right there?
Ooh, that hurts, that hurts.
Yeah, see, this is the second dorsal. This is one of the nerves that branches off to help with your thyroid there. Same story with this fellow over here. So we also need more nerve function in that thyroid.
Yeah.
Let's get to work. Is there a very particular way we need to address this
Yeah.
this hip? Because either way would have fixed it, you know, realigned it. The problem is what it will do in terms of all the other structures above it.
Right.
If I did the other way, it actually would have twisted your spine and you wouldn't like it. Whereas
Doesn't
I'm
sound
doing right, whereas I'm doing right now, it would knock out 2 birds with 1 stone. We realign the spine. I'm sorry, realign your hip, and also take some of that twist on your spine as well.
Oh, wonderful.
Yeah, that's what we want. There it is. Okay, walk around.
numbness in my right foot. Do you know what that's from?
Yeah, your nerves be pinching from your lower back there.
Okay, yeah.
Any difference to that, the numbness to your foot?
No, my right
Okay.
hip feels better.
Okay.
Yeah,
that's great.
yeah. But no, there's still a lot of numbness in my toe and my foot, but my hip feels a lot better.
Okay.
Oof.
There we go.
Yeah.
Come on up.
Oh, yeah. Okay.
Walk around. Okay, come on back.
The tingling is kind of going up my leg. It's interesting. It's like, I think it feels like it's relieving a little bit. It's right here, but my foot doesn't feel as numb.
Good.
So it's slightly better. Interesting. Okay.
Great.
Yeah.
No, that's what we're talking
There's
about.
movement.
Yeah,
There's movement.
You're gonna take that pressure off that nerve over there. Let's hit this one first.
Oof. Whoa. That was a head rush. Whoa, guys.
Yeah. Yeah, it's a biggie.
That was a biggie. Wow.
Okay, walk around.
Okay.
Tell me, what's
Okay,
different?
so numbness in my foot is almost gone.
Nice.
This is lessened. Still
Just
there a
show to
little
the
bit.
viewers over here.
Sorry. Yeah, this is the numbness is starting to dissipate a little bit. It's
Good.
almost like it's coming down my arm. And yeah, the numbness is it's going away from my foot.
Good,
Yeah.
great.
Yeah.
Now, remember what we showed you here before, because you have a lot of degeneration right there, that
Right.
neck over there.
Right.
That's a nerve that's going to your thyroid and also down to your elbows, your wrists, and your hands.
Oh,
the whole
it's
time.
gone. The numbness is gone. It just left.
Nice.
It was like, wow, okay.
It just takes some time.
Yeah.
We just gotta get that swelling down over there. Okay.
Yeah.
You're gonna follow our cold pack regimen
Right.
on that one.
Right.
Help get the swelling off that
Okay.
nerve.
Yeah, I can go buy one.
Okay.
In my office. Yeah.
All right. Let's work on the
Okay.
feet.
Okay.
Yeah, right. Yeah, it's all locked up. There's that fella.
Mm-hmm.
Right there. Wanna go?
Oh.
That's a biggie. I'm gonna get that cube on in a bit.
Oh, wow. That felt good in my hip.
Yeah, both cuboids are out. There's that fella. That's it, that fella. Good. A little bit out. There's that fella. Okay, go ahead, walk around, see you like them.
Woo. Okay. Interesting. I have a lot of, I don't know how to describe it. There's like weird sensations all over. It's kind of like a tingling, like sensation, not numbness, except for in one toe. Everything else is kind of like, I don't know. Feels good though. It's not bad. It's just almost like coming to life again, I
Hey,
think.
man, we could raise your head a little bit.
Yeah.
Let's see. Hey, there we go. Now we're talking. See, now you start to have your arches back a bit.
Yeah, and the circulation seems to be coming back.
Yeah.
Problem is I've been having like the skin here has been going white
Uh-huh.
because there's obviously because of poor circulation.
Well, the other reason why is because hypothyroidism.
Yeah.
We also call that too. So
Oh, really?
you've been noticing like whole fingertips and toes.
Yeah.
Yeah, hypothyroidism.
Oh, okay.
Okay. All right. So here's a story with this one. Okay. Because we just worked over here.
Mm-hmm. Yeah.
Okay. Your base of your neck and also the neck itself.
Mm-hmm.
Okay. We restore more nerve function to your thyroid. So give us some feedback on your next following visit.
Okay.
See how your overall energy is.
Yeah, yeah.
Other thing I also want to know, you also mentioned about you've been having some twitching in your left
Yeah.
eye.
I had it today. It's gone.
Yeah.
It's actually wow. It's gone. I had it today. Oh, amazing. Okay. Great.
All right. And the other feedback is that because we also adjusted your mid back over there,
Mm-hmm.
that's a nerve to your stomach. So let us know how your indigestion is as well. Okay?
Okay. Fantastic.
All right.
Wonderful. Thank you so much.
So give us latest updates. How's everything coming along?
Oh my gosh, after the last session you did, I mean, it was so much different work. I had my energy levels just spiked day after day. I worked out for the first time 3 days in a row, and this was the first time in months. And I felt clearer, I felt more present, sharper. Gosh, my sleeping was better. My eye twitch was still there here and there, but overall it was, you know, I just felt better. And my weight started to just come off, and then slumped a little bit yesterday.
Okay.
Yes, and then so yesterday I think that obviously some things maybe were going back out of alignment, or, you know, just definitely a sign that I needed to come back and have more adjustments made. But I felt like there was tremendous progress, and it was like, it made me feel really, really hopeful for the first time in a really long time. So, you know, today I have numbness in my both arms, which is new. And then randomly, numbness in the front of my leg here and my shin. My eye twitch is back.
Okay, you know, we'll get all that. Okay.
Yeah.
So that's what the story is, okay?
Yes.
You're still, you know, we're still stabilizing your spine
Yes.
over here. You're gonna still keep on chipping away until finally it stabilizes and it stays put, okay?
Yeah.
All right, well, thank you for the updates.
Yes, absolutely.